Has your dog suddenly started crying out in pain, dragging their back legs, or refusing to jump up on the couch? It might be IVDD, a spinal condition that's more common than you'd think, especially in dogs with long backs. Hi, I'm Lyndall from Vetster, and today we're talking about intervertebral disc disease in dogs. As usual, all of the information in this video has been carefully reviewed by leading Vetster veterinarians. Alright, let's get into it.
IVDD stands for intervertebral disc disease. It's a painful spinal condition where the discs between the vertebrae press against the spinal cord. A herniated disc, or slipped disc, is when disc material pushes against the spinal cord. In some dogs, IVDD comes on suddenly with severe pain or even paralysis. In others, especially older dogs, it can be slow, intermittent, and easy to miss. There are two types of IVDD in dogs. Type 1 is when discs become calcified and acutely dislodge, pressing against the spinal cord. This type is most common in smaller breed dogs. Type 2 is when the fibrous material of the discs slowly protrudes and impinges on the spinal cord over time. This type is most common in larger breeds. In both types, disc herniation is what causes the damage. Symptoms vary depending on what part of the spine is affected and how severe the herniation is. Watch for back and neck pain, wobbly limbs when walking, weakness, dragging of the limbs, limping, partial or complete paralysis of any of the limbs, and loss of feeling or pain sensation in the toes. Spinal pain in dogs can also show up as a hunched posture, reluctance to move the head and neck, yelping when picked up or touched, hesitation to jump on or off furniture, or trouble navigating stairs. Sudden, severe back or neck pain with a slipped disc is considered an emergency. A common clinical sign of IVDD is the loss of awareness of where the feet are, called conscious proprioception. This can result in difficulty walking, knuckling, or walking on the tops of the feet. Depending on how severe the spinal cord damage is, an affected dog may become paralyzed. Any dog can develop IVDD, but dogs with long torsos and short legs, called chondrodystrophic breeds, are at higher risk. That includes dachshunds, basset hounds, shih tzus, French bulldogs, corgis, beagles, and poodles. Over 70% of IVDD cases occur in chondrodystrophic breeds, with dachshunds having the highest rate. Larger breeds like German Shepherds and Dobermans are most at risk for type 2 IVDD, which is more often seen in middle-aged or older large dogs. To diagnose IVDD, a veterinarian will do a physical exam, including a thorough neurologic exam, plus diagnostic imaging like X-rays or MRI. A definitive diagnosis is needed before any treatment plan is recommended, because the symptoms of IVDD can look like other conditions that need very different treatment. Treatment depends on how severe the spinal cord compression is. Severe cases often require referral to a veterinary neurologist for an MRI and spinal surgery. Surgical correction relieves the herniated disc and decompresses the spinal cord. This is performed by specialists with advanced training. Severe cases usually present with partial or complete paralysis, and any acute paralysis is an emergency that requires immediate veterinary care. Dogs who can still feel deep pain typically recover from surgery in 8 to 12 weeks, with a good prognosis. The sooner surgery happens, the better the outcome. Dogs that have already lost the ability to feel deep pain before surgery have a poor prognosis, and less than half regain the ability to walk. Mild cases of IVDD, where your dog can still walk, may be managed without surgery. Non-surgical treatment can include strict crate rest and exercise restriction, pain medication, muscle relaxers, and anti-inflammatories. Long-term management may also involve weight management, exercise modification, ramps to minimize jumping, and limiting access to stairs to prevent or minimize recurrence. Surgery may still be recommended for some mild cases to keep things from getting worse. If your dog suddenly collapses or loses the ability to walk, this is a medical emergency. Get veterinary care right away. Talk to a veterinarian if you notice neurologic symptoms like knuckling, walking on the wrists, changes in gait, or weakness. If your dog has been diagnosed with IVDD, work closely with your vet to manage the condition and monitor recovery. Don't let your dog exercise after spinal surgery until your vet clears it, even if they seem to be feeling better. An online vet is a great option for regular check-ins for dogs being treated non-surgically. If you're worried about your dog's back, neck, or back legs, don't wait. Talk to your vet today, and if you need a convenient way to get expert advice from home, book a virtual appointment with Vetster. Thanks for watching, and we'll see you in the next video.